podcast and a YouTube video for you guys about isotonic, hypertonic, and hypertonic solutions dealing with like blood gases in the vascular system in the pathophysiology class. I'm going to try to make this a quick review using these slides that I created that I think do a pretty good job of explaining some of the material in class. So bear with me. This is kind of my first time ever doing this without an audience and saving it for YouTube for you guys so that you can review it at your leisure. Hopefully it's beneficial to you guys and something that's valuable that you guys will like. So let me go to my slides and let you guys kind of get calibrated to this. So what we're seeing here is here's the blood vessel itself right here with some red blood cells, platelets, and then obviously this big hexagonal shape I'm representing for white blood cells. And what you got going on here is I'm using 0.9 salt or 0.9 normal saline as the base solution to kind of represent and show how this process works. And then obviously H2O water is the component that's going to move between it's going to act as the moving or the balancing force with the semi-permeable membrane that the cell wall in the blood vessel creates when there's an imbalance between the internal, in this case, saline and the external saline. So right now we're looking at isotonic. So our internal environment in the cell or in the blood vessel is 0.9 normal saline, and outside the blood vessel we have 0.9 normal saline. So those are balanced. There's no chemical force there that's causing anything to want to move or shift because they're in balance with each other. There's no imbalance. So what we got going on there is you'll notice that the arrow represents the movement of water. So in this case, in an isotonic situation, there's free balancing movement both in and out of the blood vessel of water to keep this system balanced, and it just happens naturally. There's no real forces on it, okay? And this is normal. This is what normal situation the blood should look like between the blood and the ICF and ECF in this environment, okay? Up here in the corner, you'll see that we have a 0.9 sodium syringe. I've just drawn this, and it kind of looks a little bit like a syringe, but this syringe is full of 0.9 normal saline or 0.9 sodium in water. Okay, so there's two components here. We're going to be adding sodium at the 0.9 concentration, and we're going to be adding an amount of water that sodium is suspended in the syringe. So if we come down here, we have 0.9 in the syringe, 0.9 in the vessel, and 0.9 in the extracellular space or in the extracellular fluid. So there's again, as we add this 0.9 into the blood vessel, there's no really any forces chemically they're going to be happening. We're just adding the same concentration, and so inside the blood vessel nothing's going to happen. It's not going to change the chemistry of that or elevate or depress the concentration compared to the outside. And so again, water is going to move freely in and out. Okay, so adding isotonic fluid, will that increase the blood pressure, and why? So the answer to that is that we're going to see an increase in blood pressure when we add an isotonic fluid, in this case 0.9 normal saline, because the fluid component of the syringe, the water component, elevates the blood volume or the water component volume in the blood vessel. So that little bit of extra water drives up the pressure of the blood and the fluids in the blood vessel, and that causes the heart rate or the blood pressure to increase because, again, stroke volume's increased when the volume of fluid in the system is increased, and that's going to drive blood pressure up. And it's because of the water in the syringe, not the concentration between the sodium in the blood vessel, out of the blood vessel, and what's in the syringe. Okay, the next piece is the kinds of fluid that we're going to add to create and keep an isotonic environment in the blood vessel and in the system is 0.9 normal saline or NS, and then lactated ringers. And one of the things that I added to this slide deck that wasn't actually in the notes from class, our pathophysiology class, is what exactly lactated ringers is. So I went and looked that up, and I've added it as a note here that lactated ringers typically contain sodium chloride or just table salt, potassium chloride, calcium chloride, and sodium bicarbonate, with the last, sodium bicarbonate, being used to balance the pH, to keep the pH balanced, because we're adding sodium, calcium, and potassium, and those are our cations from our acid base cations, and so that sodium bicarbonate, the final component, just balances those out and keeps the pH balanced at 7.34 and 7.45. So we're not going to contaminate our pH balance by adding lactated ringers. We're going to keep it nice and balanced. Okay, so that's our isotonic review. So now we're going to be hypertonic, right? So looking up here, we're going to be adding a 3% normal saline to the blood vessel. So normally we have 0.9 outside the vessel. Okay. We have 0.9 normally in the vessel, but now we're pushing 3% into here. So we know that chemically speaking, anytime we have a higher concentration, in this case sodium, it's going to be drawing some kind of fluid in to try to balance these out. Now, we know from our previous chemistry and biology that this is a semi-permeable membrane, and so sodium would like to be the molecule that moves in and out and balances out to keep these both even, but we know that can't happen. Sodium molecules cannot freely move in and out of the cell wall, and so that creates that pressure gradient. And so the fluid that's moving in to balance this out is water. So water is moving from the extracellular space into the vascular space, and now we've got a higher concentration of water to sodium and a lower concentration outside, 0.9 to H2O. But if you look here, 3% normal saline and water by text size are both the same size, and 0.9 normal saline and H2O are both the same text size. And so that's just to represent that even though there's more sodium in the blood vessel, the water has moved to keep this balanced, to keep this, and we've kept that pressure gradient. Now it's in balance because the water has moved to match the 3% sodium, and now it's technically balanced because by volume, all components inside and outside the vessel are in balance. And I'm going to add a little thing that shows some of this in a little bit more detail and how these get balanced, even though we have 3% outside and 9.9 outside. But just for today, for this kind of discussion, just know that this is hypertonic because we have a higher concentration inside the vessel. We've stimulated that by adding 3% normal saline through syringe or through adding an IV and putting it in the vessel, and that's drawn water from the extracellular space into the blood vessel, and so you see the arrow moving one way for water. Okay, where are we adding concentration? Well, we're adding concentration to the blood vessel by this syringe in the blood vessel and creating that higher concentration. Now, does this increase blood pressure or decrease blood pressure? And we know from our previous discussion, isotonic, that anytime we draw water, either by putting it in through the syringe or bringing it in from the extracellular space with this chemical difference here to match it, we're drawing that fluid in. That fluid volume increase is causing increased cardiac output at the heart, and that's going to drive the blood pressure up. So if they're low blood pressure, we're going to give them a hypertonic solution, and that's going to drive this blood pressure up. Okay. The kinds of fluids that we use to do that is, in this example, it's 3% normal saline, but technically anything greater than 0.9 normal saline is going to be hypertonic, just because 0.9 is the environment outside, and we want to be higher than that. So 1 or greater is going to be hypertonic, and it's going to cause this water to come into the vessel. But in this example, and what we're going to find like in the hospital environment, it's going to be 3%, 6%. There are standards that they have that are in your kit that are in saline bags that they make. And so I use the example of 3% because that's what you're going to see in the hospital. Okay. D50 is glucose based. It's a sugar. And that's just saying that D is the density of sugar, dextrose, to water. So in this case, D50 means that 50% of that solution is sugar and 50% is water. So this one here is very, very thick with water. So in this case, we'd have, say, like we know that D5W is hypotonic. We're going to talk about that next. And D10W is hypertonic. And in this example, we're using D50, but anything greater than D10, D10W or greater is going to be hypertonic, and then D5W from the saline, the glucose solutions that'll be in the hospital with us, D5W is considered a hypotonic solution. Albumin and hetastarch, these two, albumin's a protein base, and hetastarch is also a sugar or glucose base, and glucose being a polypeptide molecule, and protein being a protein, albumin being a protein, those are larger. So instead of it being actual concentration particle to particle, this particle to this particle, and this particle to this particle, those are larger molecules. And so there's two forces that can cause this. Concentration due to just concentration, total number of particles, and then also by size. I call this the gravity principle, that these larger molecules are like larger planets in our solar system or even our sun. due to gravity, because of their mass and their size, they draw smaller particles to them. And the smaller particles that you would consider in this case is water. So albumin, it's protein, because it's so large by size, when we add it through syringe to the blood vessel, it increases the protein concentration in the blood vessel, and those large protein molecules have an affinity for these smaller water molecules, and so they draw those molecules into the blood vessel. And the same is true with hetastarch. Glucose is a larger salt, and so because of its size, and that we're making the concentration higher, it's still going to cause this hypertonic force to draw those molecules in, those molecules of water in. Okay. What should be our concern when we do any of these kinds of therapies hypertonically? Well, fluid overload, right? We can cause this to get really, really high, the fluid level inside the blood vessel to get really, really high. And so that's called fluid overload. And our treatment as nurses, the way that we stop this is by doing our fluid challenge. Every 500 milliliters of our bolus push, we're going to check the vital signs, being blood pressure, pulse, and auscultating their lung sounds and looking for abnormalities, either a too high of jump in the blood pressure or pulse, or we're getting fluid on their lungs, which is that pulmonary edema. They're going to get fluid on their lungs because of fluid overload, which is going to be not good for them. That's a negative response to IV treatment or IV therapies. And so at that point, we would stop that therapy. We'd stop giving the hypertonic solution, and we'd adjust our treatment to match that fluid overload condition and let their body adjust to these fluids that we're adding. So that's that system and stuff. That's probably a down and dirty for that, but I think it does a pretty good job of explaining this. Okay, our last condition is hypotonic. So again, if you look up here, we're adding a 0.45 normal saline to our blood vessel, and we learned before. So we're adding 0.45 here. We're lowering the concentration inside to the 0.9 outside. So this is larger now. There's a bigger, larger force or larger concentration of sodium outside. And so our arrow is pointing outside. It's drawing water out of the system. And now we have a larger concentration of sodium outside, a larger concentration of sodium inside. And we've had this 0.45 sodium inside and a smaller concentration of water on the inside. So that's hypotonic. And so the times that we would give this is we want to draw fluid out of the blood vessel. And this we would do for someone who has high blood pressure. We'd have with this to draw fluid out, and it would lower their volume of fluid inside the blood vessel and cause them to go into a lower blood pressure condition. And that's our hypertonic forces. Okay. What should be our concern here? Well, dehydration in the blood vessel itself is a big issue. So people with diabetes and people with burns, diabetes, they've already got elevated glucose and different components in their blood. It's already very viscous. And so this aggravates that, and it makes them more dehydrated. It's very unhealthy for them. And then burns, because their skin and stuff has been burned off, the controlling forces for fluid evaporation and loss are gone at their skin. And so they're already in a condition of dehydration in their vasculature. And so now we're aggravating that by drawing more fluid out. And for people with burns, it's very, very detrimental to their health and can cause them to go into shock. And it's very, very negative. It's a negative response for them. Where is the concentration added? Well, technically, we're not adding concentration to the blood vessel. We're lowering the concentration here. So artificially, the concentration is now greater in the ECF or ICF outside the blood vessel, causes that water to come out, elevating water levels outside the vessel. Does this increase or decrease blood pressure? And I just talked a minute ago about how this decreases blood pressure. This is going to lower the blood pressure of this patient. Okay. The kinds of fluids that we consider hypertonic, okay, would be 0.45 normal saline, as in this example here, then D5W glucose, and then we really don't have a protein that we've learned about that would cause it to be a hypotonic condition, where if we add protein into the blood vessel, it's going to be hypotonic. And so I just say there's no protein that we can add that makes this hypotonic. Okay, that's our slides for the day, kind of covering this hypo, iso, and hypertonic conditions and the IV therapies and whatnot that we're using for that. And I'll leave that with you guys as part of our now videos you guys could go to on your own self-starter stuff, and you guys could review that at your leisure and get spun up on that. That's my video for today, and I'll hopefully talk to you guys later. And have a good night. Bye.